And this week for the digest, I wrote about REPRIEVE, the randomized trial to prevent vascular events in HIV, which is run by the NIH. We know that people with HIV have an increased risk of cardiovascular disease compared with those not infected with HIV due to increased prevalence of traditional cardiovascular disease risk factors, HIV-specific mechanisms like immune activation and inflammation, and older antiretroviral regimens. REPRIEVE is the first large-scale clinical study to test a primary cardiovascular prevention strategy in people living with HIV. The trial enrolled nearly 7,800 participants with HIV over 100 clinical sites in 12 countries across 5 continents. All participants were on antiretroviral therapy for at least 6 months, had CD4 counts greater than 100, and had a low to moderate traditional cardiovascular disease risk that would not be typically considered for statin therapy. Participants were randomly assigned to receive 4 milligrams of pitavastatin daily or placebo. A planned interim analysis found that participants who took pitavastatin lowered their risk of major adverse cardiovascular events by 35% compared with those receiving placebo, which resulted in the trial stopping early due to adequate evidence of efficacy. This all was relayed in a recent NIH press release